So this edition of Meet Your Provider, we're once again having a great conversation with Dr. Stuart Leicht. And Doctor, we want to talk about today what sets your practice here apart from other practices around the Tri-Cities.
Yeah, exactly. I wanted to talk about that. Previously, I discussed with your viewers the fact that I've been in practice more than 40 years, that I spent 36 years at the medical school, helping to train residents and medical students, many of whom are still out in the area. But today what I really want to emphasize is what's different about our practice and others, and specifically what you won't experience when you come to our practice. Firstly, you won't have long waits. It doesn't take months to get into our practice. We have immediate or near immediate openings where we can accommodate you. I've heard complaints from patients that if things change or their disease process isn't going well, they have trouble getting a follow-up appointment, we can get you in generally very quickly with that also. We have continuity of care. You won't see a different provider every time you come in here. I hear that complaint over and over again. There are only two of us here. There is Jennifer Green, who's excellent, who works with me, and myself. I endeavor to see almost all of the new patients that come in. If I don't, she'll see you. She'll come out, present the case to me, much as it's done in the medical school. We'll discuss what needs to be done, then I'll follow her back in, confirm the findings, and we'll determine what the care plan will be. You will see the doctor. It may not be every visit, but if there are any problems, she'll again have me go in, discuss it with me, and we'll decide what needs to be done. If it's routine, then you may see her more, or you may see me on a continuous basis. We don't have quotas. Many of the providers, particularly the non-physicians, have to see a new patient every 15 minutes. We'll spend, or we endeavor to spend, as much time with you as is necessary to determine what's going on, what optimal care is, and hopefully you're satisfied with that, but we don't stick to any time limits with that. We don't push cosmetic procedures on people. We do have Candace, whom we've introduced before, who's excellent and provides some specific cosmetic procedures that she's very good at, but we certainly don't push people into doing that. We don't hawk or push our own cosmetic line. We're just not about that. We really try to minimize your contact with the computer. I hate computers. I hate portals. We don't have you, in fact, we request you don't fill out the information from the portal. No one looks at that stuff anyway, aside from the medications and your past medical problems. But particularly, I really despise portals when they put the laboratory data or test results on it. I've seen many patients traumatized when they go on there and learn that they have a cancer or there are significant abnormalities. They have no opportunity to talk to someone. We don't do that. If it's something routine and we do a biopsy, I'll pen a little note on there, we'll send it to you. But if it's something significant, we call you back, bring you back and talk about it. I think it's just a terrible thing to get a notification that you have a cancer when you're on vacation or it's over the weekend and you have no opportunity, you don't know how serious it is, et cetera on that. We don't push Mohs surgery on people. If it's appropriate for you, certainly recommend it if it's the best possible treatment or that's what you want to do. If there are other modalities that are appropriate, we'll certainly discuss that. And we're the only office in the region, as we discussed previously, that offers image-guided superficial radiation therapy with gentle cure, which is a non-surgical modality with a 99% cure rate, the equivalent of Mohs, and can treat people often without any scar or distortion of their eyelids, their nose, their mouth, and I think is something that needs to be discussed, and in the interest of patient autonomy, patients should be able to decide what they want to do as long as there are equivalent cure rates on that. Lastly, I'd like to emphasize that although many people of different endeavors are documented as doctors, and I'm a medical doctor, there's a difference. I'm a physician. A physician in Latin is a teacher. And I take that role very seriously. I spent 36 years with the medical school, as I said, training residents and students, helped train a nurse practitioner that works with me. I think we take the time and interest here to have a patients understand their disease process, but more importantly, understand the treatments, the impact of treatments, complication of treatments, and I hope that we do the best possible job for our patients regarding that.
It just sounds to me like you take a very hands-on, common sense approach to getting the people the treatment they need in a timely fashion.
I think we do. And moreover, I think most patients really enjoy their experience here. Over and over again, we hear it's fun, as much fun as you can have visiting a physician anyway. I think we're appropriate in that, but we try to decompress and have patients feel free and comfortable discussing all aspects of their care and their concerns, and we listen to that.
All right. Dr. Stuart Leicht, thank you.
Thank you.
We appreciate you so much. Folks,
Thank you.
that is this week's Meet Your Provider with Dr. Stuart Leicht, finding out what sets this practice apart from so many others across the Tri-Cities. The preceding segment sponsored by Dr. Stuart Leicht.